Paraphimosis. Paraphimosis only affects those individuals with a foreskin. Now, if you've watched my phimosis video, that's where you can't pull back the foreskin. It's very difficult to pull back the foreskin. Paraphimosis is where it's still difficult, but you can pull back the foreskin, but it gets stuck there and you can't put it back and it gets painful. And like my finger is getting swollen, so does the top of the penis. And paraphimosis is a medical emergency. And so if you're watching this thinking, I've got paraphimosis, what do? You go to hospital, okay? You go to the emergency doctor and you say, I have paraphimosis. If it's during the day, you can get through to your GP or ideally a sexual health doctor, you go and see them. If you're a doctor and you're watching this just for educational purposes, then what do you do if you've got a patient with paraphimosis? Well, one thing you don't do is you don't just grab hold of the foreskin and pull, because what you'll do is you'll tear the foreskin and then you'll have a bleeding foreskin, and foreskins bleed a lot, which will in itself cause a lot of angst for everyone. So ask if the patient has any allergies or if there's any other problems around. Examine the penis for any signs of trauma and infection and deal with them. Take the necessary swabs. If everything looks good and intact, you take some lidocaine gel, for example, Instella gel. You liberally coat the head of the penis, and if you can, get under whatever foreskin you can get under as well, doing it nice and gently. Then you take some gauze and you slowly press on the head of the penis, okay? And you're trying to reduce the size. You then take your other hand and locate it and just put make a ring on the underside of the penis. And what you're doing is you're not pulling the foreskin over the head, you're gently compressing the head of the penis and pushing it into the foreskin. So you're not doing that, you're doing that, okay? And you take it very, very slowly. Could take 5, could take 10 minutes. Normally doesn't take that long, but you just take a very, very slow time compressing the head of the penis. So don't do it quick as well, because it's full of blood. You don't want to burst blood vessels or cause more trauma. You just take a very, very nice, gentle approach. Chat to the patient, make sure he's not getting too upset, and also make sure he's not feeling any discomfort or any pain. And then as soon as you're able to eventually complete it, allow the foreskin to go over the head of the penis and allow the patient to rest. The patient then needs to be re-examined 15 to 20 minutes later just to make sure it hasn't naturally gone back over, and the patient has to be given strict instructions not to pull back the foreskin until the swelling has gone down. Usually the swelling around the foreskin has gone down quite adequately after 20 to 30 minutes. I personally quite enjoy doing these paraphimoses, but if you're a patient watching this, it is a medical emergency and get it sorted out sooner rather than later. It can also happen quite frequently in care of the elderly medicine, and patients are unable to touch their own genitals, and what happens is the nurse comes, retracts the foreskin, cleans them adequately, replaces a catheter, and then forgets to put the foreskin back in its position, and this then swells up over the next 1 or 2 hours. Either way, it's still a medical emergency and needs to be sorted out. It can be dealt with quite quickly if you know what you're doing. If you don't know what you're doing, speak to a doctor, go to the emergency department, get it sorted out now. Thank you, good luck, take care.